Hi, everybody. It's Ashley and Linda here.
Hi.
And I'm going to do a quick introduction. Everybody's kind of, if we look at this area, then we'll be looking in the same spot. It's hard because we want to look at each other. We are sitting in my office at Home Holistic, and Linda is one of our pelvic floor physical therapists here, and she's amazing. She's also a yoga teacher, but she's been doing women's health and pelvic floor work for how many years?
20 plus.
20 plus years.
Mm-hmm.
So we are so honored to have pelvic floor physical therapy here, because I will tell you, as long as I've been doing prenatal yoga and postpartum yoga and birth doula stuff, people come in and say, is this normal? Is this normal? Is this normal? And I would say it's common, but it can be treated. And so often our providers say to moms postpartum, like, you know, you had a big baby. And this is just really normal. It's just part of having a baby or part of being a woman. And Linda is going to kind of dispel some of those myths and talk to you about why we really believe that pelvic floor physical therapy is really essential for women's health. Earlier this week, we had several people send in questions. She will answer all of those questions today live on the video. And then if you have questions after we're done, then put those in the comments. And Linda is on Omamas, and she'll be able to
See them and
see
respond
them. Yeah.
within, 5 o'clock tonight?
Yeah, that we'll kind of close commenting this evening, but the information will stay there for you. Before we leave also, I will make sure that everybody has Linda's contact. So if you want a consultation with her, an appointment with her, or to talk to her, that you'll be able to find her.
I am
and it's
on your
pretty
website
easy.
now.
I
Yes.
know. She is on homeholistic.com. Oh, hi, Laura. Yes, you do. At homeholistic.com, all of our providers are on there except our other pelvic floor physical therapist, Shannon. And she's taking a few weeks off, and I think by the time she comes back, her info will be up.
She's working on it now.
Yeah. So I will let Linda kind of take it away.
Okay, well.
Yeah, tell us about yourself, Linda.
Okay. I've been a physical therapist for 30 years, the last 20 in pelvic floor rehab. I did work in a local hospital-based clinic. I was the only therapist there, so I saw anybody and everybody who had pelvic floor problems. It was sent to me. I love this work because a lot of people are like, physical therapy after having a baby, or what's she gonna do? And physical therapists are the experts in muscle, bone, joint, and movement. There's a lot of other practitioners who deal with muscles, bones, and joints. But as far as movement goes, or what the muscles are supposed to be doing, physical therapists, I think, are pretty good there. And in terms of giving exercises, individual exercises for what's going on with your body. And so in this area, there are specialty therapists in the pelvis, and for the pelvic floor. To be a specialty therapist, there is a certification. I have mine. I got mine in 2010, and so did Shannon, the other therapist. It's a 3-level education plus a lot of testing and research with case research. So if you're looking for going to a therapist to deal with you in this area, make sure that they have their certification. You don't have to have a certification to be practicing this kind of work, but if you have your certification and you go to someone who is, you're going to get a better evaluation.
And what we've seen, that we've been sharing referrals for many, many years with Shannon and with Linda. And what we see is moms who have been not able to have sex are able to have sex again. Moms who are incontinent, both types of incontinence, and she'll kind of explain that, maybe. But if there's anything going on in the pelvic floor, like when I cough, I pee, sometimes I just poop. And I didn't know I was pooping. That all of these things really can be treated, and it's a magical experience when you're with somebody that is an expert in this. And that you might have a physical therapist, or you might have yoga teacher, whatever it is, that for me, when you've got something specific going on, like pregnancy, postpartum, any kind of specific issue, go to the people that do it all day, every day.
Yeah, all day, every day. And again, those things that Ashley mentioned, like the leaking when you cough, sneeze, laugh, or pain with intercourse. I think what always amazes me is my clients or patients will say, well, I was told it's just going to get better, or just wait, it'll get better. You're just this and this and this. And at least in muscle rehab, my theory is the sooner you get on it, the better. Mm-hmm. Now, some things we have to wait 6 weeks postpartum to have your midwife or doctor's check to do. But otherwise, muscle, use it or lose it. So as far as therapy is concerned, the sooner you get on this, the better. And I know a lot of your questions out there are about the Kegel exercise, because is she just going to talk to us about Kegels, or just tell us to do your Kegels? Well, the research does show that if you are...
I'm doing Kegels right now while I'm talking.
Good,
by the way, as soon as she said it, I'm like, I'm going to do it.
Well, the research shows that if you're taught how to do a Kegel by a brief verbal instruction, like maybe I say 2 minutes here, and I say, this is how you do a Kegel, or I give you a piece of paper, here, just do your Kegels, that'll get better, just wait, it'll get better, is that 50% of ladies will do them wrong. Now I know you perfectionists out there are going to say, oh, I want to do it right. But just know that women are vulnerable in this area. And a muscle, when it gets stretched, like during pregnancy or birth, it loses its ability to sense or contract. And so doing Kegels can be a very tricky process. And so therefore, you could consider me kind of a Kegel coach. I work with you one-on-one, making sure that you do a proper Kegel. Because Dr. Kegel was that doctor back in the 1950s that said...
I didn't know there was a Dr. Kegel.
Oh yeah, that's what it's named for. He was a gynecologist. And he said, ladies, these muscles are just like any others. Use it or lose it. So if you don't do exercises, conscious exercises, you will have some problems later on. So the exercise is named for him, but what is a Kegel? Some people say, oh, that means you stop your pee 10 times every time you go to the bathroom. No, not anymore. Don't do that. They found that can mess up your nervous reflexes and make you not fully empty your bladder. So that's a test. I tell people that's a test. If you have strength, you can stop your stream. But if you can't, then you're pretty weak in your pelvic floor. So what
if I'll tell you a little bit about myself. I had an extended episiotomy with my first baby without permission, FYI. And so if you don't know what that means, when it's an extended episiotomy, it means it's cut all the way through your rectum. So I had one giant hole instead of 2 separate holes. Since then, if I sneeze 3 times, I pee a lot. And it feels like if I sneeze the first time, I can engage. Second time, I need to cross my legs, maybe even put my hand in my crotch. Third time, I'm just peeing. Yeah.
Okay, well, again, physical therapists' muscles are their specialty. So if these are pelvic floor muscles, everything you see red here is muscle. So a physical therapist is going to do a thorough evaluation of strength, endurance. Ashley, that sounds like an endurance problem. You have enough strength for these muscles to hold 1 or 2 seconds, but if you've got 3 sneezes in a row, they're gone. So strength, endurance, coordination, relaxation, and length, all those things can happen in all these 3 layers, 30-some muscles. So it's not as easy as Dr. Kegel, I think, believed. It's pretty complicated.
Well, he was a boy.
So you do have 3 layers of muscles. You have 3 functions. They are sexual muscles. They are supportive muscles to support the organs. And then there's sphincter muscles. The sphincter means circular, so that you're closing around anal, rectal, vaginal. So those are the continence muscles. So 3 layers, 3 different functions, 3 different kinds of contraction. This is interesting.
It's so interesting.
Neurologically.
If you work with mothers, this is just blows my mind.
Okay, so I probably blew your minds already just with that, saying, oh my God, there's Kegels are that complicated?
Yeah.
Because the 3 different kinds of contractions, you can have an isolated sphincter. We can only contract our anal sphincter, or we can only contract the other 2 sphincters. Isolated. Why would you ever want to do that? If you're having trouble with your anal sphincter, having an injury, you may want to just isolate and work on that Kegel, anal sphincter Kegel. You also have a combined contraction, which means you contract all the sphincters back to front, almost like a drawstring. So you're tightening up all those. That's the best for any kind of incontinence. And then the third kind of pelvic floor contraction is the supportive one, the one where this area just lifts inside, almost like a vacuum. Or a lot of people think about the floor of an elevator. This is the pelvic floor, so you're taking that floor up into the elevator shaft. And that's a contraction of this deepest layer, and that's the kind of contraction that's most important to hold your organs up.
Yeah.
So which one is a Kegel? In my opinion, they're all Kegels, but if you see someone like me, I'm going to find out which one is most important for you to work on.
Oh, that's so good. So it is so interesting, Jessa. Hi, Jessa. We miss you. We are going to go to questions that people submitted earlier in the week. If you have specific questions or even just like want to share like a little bit of your story, you're welcome to do that. And if we can get to that, we will. If not, we will after we're done with the video. We'll for sure answer your questions. So I think that we already asked about strengthening the pelvic floor.
Yes, there was a question on what can we do besides Kegels during pregnancy to strengthen the pelvic floor. You already know from my explanation that Kegels can mean many things, but during pregnancy, I think what physical therapists would stress is do a pelvic floor contraction, and maybe not even call it a Kegel, functionally, because muscles need to function. And so when do you need these pelvic floor muscles? When you cough, when you bend, when you're exercising. So during pregnancy, doing your Kegels means thinking like mentally and gently activating, turning those muscles on every time you bend, while you're walking for exercise. If you're carrying toddler on one hip, a gentle mental setting of the muscle, not a clenching, but just a setting. And that sounds like, do I just think about my pelvic floor? A lot of times in the early stages, it is a lot of mental work, awareness, imagery, things like that to wake them up again.
Yeah, and I think, I see moms have babies. I see a lot of vaginas. It just happens to go hand in hand. And it seems to me, too, women that have healthy pelvic floors tend to, and I might be crazy, have less tearing. Because they understand that they're not just blowing it out, that they're isolating the right location.
Yeah, and actually during birth, you need to be able to relax those muscles and let them lengthen, because they are to relax the muscles that allows urination, defecation, penetration, and birth. So if you're nervous, anxious, hurting, your muscles everywhere will tense. So someone who has good pelvic floor awareness, knowing how to contract, find them, feel them, and also relax them, will be better off for birth.
Yeah, I think so too. And women, I believe, have really been taught to, not have a lot of body awareness. Don't eat too much. And so if you're hungry, we don't eat it too much, or you're eating too much. And we're like, I feel like I'm not full, whatever it is, that we've been taught since a very early age to not listen to our body. And that's the wrong way to move through life. And if we're aware of our pelvis, we'll also be more aware of what to do in childbirth, how to heal after childbirth, but also how to enjoy sex.
Yeah, I agree. And awareness is key. If you think about it, if anyone had lectures in posture when they were little, like if it was your mom or a teacher or a military officer, stand up, pull your shoulders back, head on straight. You actually had to hear that over and over and over again until now you don't need those people telling you, oh, look, she's got great posture. So what happens down here in the pelvis is awareness again. That's why having someone help you with your Kegels or knowing how to contract and relax, learn it until it becomes second nature.
Isn't that right?
So I feel like I'm most successful months down the road when ladies, I say, how are your Kegels going? I use that phrase kind of, just kind of general, but how are the Kegels that I taught you, which might be very specific to that woman, how are they going? She's like, oh, I don't even have to tell myself. They're just like right there. I feel them all the time. So that awareness is really important. And these muscles are the end of your trunk, so that means they're part of your postural system. So as much, cueing as you needed to keep your head and shoulders back, the cueing is needed there until automatically, oh wow, there's my pelvic floor. I don't even have to think
They've got
about
good
it.
pelvic floor posture.
Yeah.
Oh, I love it. I love it. So let's say somebody just had a baby. They come in to postpartum yoga, mommy baby yoga, and they are really struggling with their pelvic floor. Is there anything that you would tell that person to do in 1 to 5 minutes a day?
Is actually, well, when you're talking yoga, let me go ahead. There is a whole focus in yoga on the pelvic floor, and there's 3 of us here that have our pelvic floor certifications in yoga. And take a look at this anatomy. Now you can tell, ladies, this is the vagina, rectum, and urethra. But the bony pelvis has the pubic bone slant. It has these big, thick ligaments on either side, and then the pubic bone again. So, ladies, can you notice a diamond triangle here? Okay, so, and guess what? In Sanskrit, in yoga, the Mula Bandha or the Muladhara, the root center, one of the symbols for it is a diamond. So if your pelvic floor is either so stretched out or still healing that you can't feel it, find it, or whatever, visualize that between this anatomic diamond, during your postures, that you're lining up your diamond nice and even, and that you're pulling your muscles away inside the diamond, because pelvic floor shouldn't really have any bony movement. So if you do a Kegel, it's not like you're tilting your diamond side to side, or it's not like, oh, I'm doing a Kegel and you're squeezing your butt and you're tilting and all this other stuff. There shouldn't be any visible bony movement. So
It's like your hips wouldn't be rocking.
No,
if you
no
were on your
pelvic
back, you
tilt.
wouldn't be lifting or...
No. So just visualizing that you're pulling these muscles up and inside that diamond, or from the deep layer with the organs gone, almost like a vacuum up and in, and think it and think it and think
Jessica,
it.
who's my doula partner, also prenatal postpartum yoga teacher, says imagine that you're picking up a blueberry.
Blueberry.
Yeah.
Now that would be sphincter. That would be a sphincter. But then where does she
And then
take?
you're lifting. That you're bringing it up.
So that's actually a combined contraction of 2 of the layers. She's got the sphincter, and then she's doing the deeper lift.
Yeah.
I loved having most of the layers working, because you'll get your best support and continence care at that time.
I have another question. Common pelvic floor dysfunction. Is it common? Tell me how I'm supposed to say this.
Okay.
The question was, is there something about common pelvic floor dysfunction that people, and my guess is she's asking physicians, incorrectly attribute to other diagnoses, right?
There is a medical diagnosis called pelvic floor dysfunction. And since the pelvic floor is mostly muscular, pelvic floor dysfunction means that these muscles aren't functioning well in those three functions. Sexual, so you can have sexual symptoms if you have pelvic muscle dysfunction, pelvic floor dysfunction. Support, so you can have organs starting to drop if your pelvic floor dysfunction is there. Or the third function was sphincter, so you can leak. So dysfunction means something is not working right the way these are supposed to. So think about your plumbing in your house or your electrical in your car. Those are systems, and so is this pelvic floor a system. So if you have a dysfunction in your plumbing in your house, there are a variety of symptoms that can happen. Your toilet could be overflowing in this room, or your basement pipe can be leaking. Same thing here. If you have a pelvic floor dysfunction, there's a lot of symptoms that could come along. And it is a mix, because some of the symptoms may make doctors or other healthcare providers think or go the organ route. Let me check her organs out, like constipation, pain.
And so then would they be treating for constipation or?
Well, I do depend on the doctors, the midwives, to clear organs and things like hormonal imbalances, cellular level, the organic stuff. If they find something there, they need to deal with that. But that doesn't mean you can still have, because you might have a primary organ problem, you could still have dysfunction in this pelvic floor. You can have 2 things going on. Many times doctors will send patients after they check out all the organs. If all the organs are okay, but there's these strange symptoms like I have a bowel movement and my hip hurts. What's that about? Then go to the therapist. You must have pelvic floor dysfunction, and then be assured, if you are with a certified pelvic floor therapist, she will check out what function or dysfunction is happening here.
Yeah.
And we also are trained enough, if someone comes and they think it's muscular, we have red flags that say, oh no, this can't be a muscle at all. So I think the healthcare practitioners do depend on us to do a good job at finding the dysfunction here, but it is a tricky thing.
Yeah. Yeah. Okay. Are there any exercises postpartum, and we kind of covered it, that help with proper pelvic floor alignment?
Okay, well, if you're a yogi, just visualizing this diamond when you're doing your postures and pulling up.
So any posture. So think of warrior, chair, any like standing posture.
Yeah, and the diamond this is your pubic bone in the front, the junction, the pubic symphysis. These are those pubic slants. These 2 points are your sit bones, and then this point is your tailbone. So if you can just line up your diamond so that it's nice and even, a lot of ladies will have twists or turns and they'll feel one sit bone down. You usually have to work through the feet on that to kind of align that. So that's what you could do for yoga. If you're like just walking for exercise, like we said, why not visualize like from the red house to the blue house? Let me see if I can call up, become aware of my pelvic floor. A lot of ladies want to do like core workouts, like lunges or squats and things like that. I would say during pregnancy and postpartum, tone down the depth or the depth of those things and tone down the width of your stance. Because during pregnancy, your joints are loose, your hormones are kind of softening those. So you don't have to do a deep squat to get, good glutes. Just enough to feel the muscle contract. And postpartum, if you're breastfeeding, those joints still stay loose. So don't think, oh, I'm 6 weeks postpartum, I'm going to go back and do my, pre-pregnancy workout.
Yeah. And even if you're not breastfeeding, your relaxin hormone stays 5 months postpartum. And so your joints are looser. And so it's, just not a great idea to find your depth or to lift really heavy weights. It's just like really intense on your joints for the first 5 months postpartum.
I know a lot of people don't feel like they're getting a good workout, but you are. I mean, you're getting the workout you need without injury.
Yeah. Yeah. That I think it's just such a hard thing for our brains, to be like, I'm doing enough. And let me assure you, mothers, postpartum moms, you are just being postpartum moms. You are doing enough, and any movement is really useful. That a slow walk can help regulate your nervous system and help when you're doing a proper pelvic floor engagement, awareness that all of those things are healing.
Yeah, if you go through life too fast, your other muscles will kick in, because postural muscles need slow input, slow awareness input. So yeah,
it's amazing.
Something about the alignment, something about how do you keep your pelvis aligned, which is very common during pregnancy. Something, especially like these sacroiliac joints might slip out, or the pubic symphysis starts to separate, or the hips snap and pop. During pregnancy and after, there is a brace. I'll give you a little thing here that does hold the bones together, although it's not for everybody. It's called Sorolla belt. They're
amazing. Yes, they're amazing.
But it's
we should sell them here.
Yeah.
Maybe I should get some.
They're not for everybody, because if you get it and it hurts, then more than likely you might have swelling in here, or you might be malaligned and you're putting it on and it's holding you out of place. But it feels really good because it's just a little belt like this. Well, actually, if I stand up, I'll see if you can. All right. And when I do laundry or heavy duty work, I mean, even I to this day go and grab for my Sorolla. So it goes low over the pubic bone.
I'm gonna just change it so you guys can see it a little bit better.
So here it is. It's just a little belt. And again, it's not for everybody, but you can see how I'm putting it low over the pubic bone, so it's gonna hold that joint together. If I'm swollen, that might not feel so good. And then in the back, it's gonna cover my 2 sacroiliac joints and be really low on my sacral bone. And then when I pull these 2 together, like that, what it's done is just cinch my bones. So basically it's just it's a ring around the pelvis to try to hold these joints together and these joints together. You can get them online. A couple of the running stores in town have them. I think they're in the high 30s or low 40s.
Yeah, but I think you can get them at Amazon.com.
Yeah,
they'll deliver it to your house, girls. Okay, our last question that we're doing live today is, what are your thoughts about a misaligned pelvis or pelvis floor dysfunction being a cause or a contributing factor to postpartum depression, postpartum anxiety, or rage?
Okay, the depression and the rage, those are more behavioral, mental, on the emotional side. There are the theories in alternative medicine that and of energy centers in certain parts of the body, and I think that question is coming from there maybe, that if your pelvis is out of alignment and you've got energy in this area that's being moved in different directions, is that going to affect my emotions? I can't say as a physical therapist that we have any background in that, but what I can say is I always want ladies to have the most balanced, aligned pelvis, because that's just good health for all those organ systems in there.
Yeah, and literally, the body keeps the score. And so if we've had trauma in childbirth, if we've been touched without permission, even if we had a successful vaginal birth and baby is okay, we can still have trauma from that birth, even though everybody is okay. I don't know if I'm saying that right, but because of that, then our pelvis is out of balance. We're having dysfunction. We're not able to have sex. We can't connect with our partner. Of course, those are going to be contributing factors to postpartum depression, anxiety, rage. And to me, when we are unbalanced, whether it is emotionally or physically, structurally unbalanced, it's really hard to feel balanced. And so that's a whole nother topic, girls. But
also the hormonal component, the hormonal imbalance of postpartum does a whammy on your mood. So
yeah, but things that feel so normal prenatally and postpartum. When I had a mom come into class last week and she's like, I'm gonna kill my husband, and she was really out of sorts. She's like, I don't normally feel this way. Everything's irritating me. And so we can talk about that in class, or direct message me. But I think that we're just in agreement with moms are going to feel better, and you'll feel more like yourselves when your body feels good.
When you're balanced.
Yes. Yeah. So anything else before we close, Miss Linda?
Here's my logo, and it is on the Home Holistic site under Wellness, the Wellness tab.
Yeah, if you click on Wellness, all of our practitioners come up. There's a lot of us. And then you'll click on physical therapy. And then we have an infant and toddler physical therapist and 2 pelvic floor women's health physical therapists. And Linda's one.
Thank you.
Yeah, thank you. And then if you have more questions or want to share your story, share it here. And then we'll be checking in throughout the day. Thanks, moms. Bye.